guys! This video is to introduce you to a little project I did during third year. It's a clinical notebook that I designed specifically for senior vet students or new vets. If you're just here for the crash course on how to use it, feel free to jump to that later section. Otherwise, I'm going to talk a little bit more about what the notebook is and why I did it. I call it the Vet Student Handbook, and I have my BabyVetYino logo laser engraved in here. It comes as a notebook with clinical references and some basic knowledge that you may want to review very quickly when you're in clinic. I started thinking about something like this roughly at the beginning of third year. I really wanted something like this for my clinical year, and I wanted something that I can carry with in the hospital, and I wanted to be able to take notes with it. But I didn't want to be on my phone all the time in front of the client or my colleagues. So I thought, what about a pocket-sized notebook? And I wanted to be loose leaf pages too, so I can move the pages. Say I'm on a neurology rotation and I want to write down my findings for a neuro exam, but I don't remember which area this nerve corresponds with. And I can just take an empty page and flip to the page I want to look at, put it right next to it. And now I would be able to write down my findings while looking at the references. Or if my instructor talks about something that I want to take notes under this section, I can keep this sheet here, and the next time I flip to the neuro section, I'll be like, oh, this is what I learned last time. I'll take note of it this time. You know, just like little things that makes your life easier. With a notebook, you can also choose to get a ruler. If there's a mass or a lesion, you can quickly use the ruler to measure it. You can also get this pouch or pocket. You know, some lab results come in small pieces of paper or whatever you want to put in there. For the leather notebook, it also comes with a notepad, some pockets, and a pen holder too. You can also have your name engraved on the cover, which I find super cool. I have one here. The greatest value that I find with this notebook is that it's quick and cohesive. So I want to help people maximize their learning by having this crash course. Because what's the point of having it without knowing where things are when you only have like 2 minutes to look things up? Just gonna take the reference pages out and go through them one by one. When you get your notebook, all the pages are in the same order. They're not numbered, but they're color-coded, so you can move the pages later based on how you like it. Okay, so we are gonna start with the pink page. The first page includes TPR references for dogs and cats when they're awake or under anesthesia. There's also blood pressure, SpO2, endotracheal CO2. The diagram at the bottom shows the location and drainage of the commonly palpable lymph nodes. Flip to the back. You have the TPR for the other species, including the large animals and some commonly seen exotic animals. There goes our first page. Next, we have 2 pages for emergency and critical care. The first section, patient monitoring and stabilization, is a pretty standard protocol for most emergency patients, especially the basic assessments, which I highlighted in red here. Then we have a trauma protocol. It has some tips for thoracocentesis and abdominal centesis at the bottom. Flip to the back, we have a GDV protocol for triage and stabilization, and a very brief blood transfusion section that I'll probably expand on for the next edition. It has some useful tips that you can just take a look at. On the next page is a flow chart for a patient that presents in respiratory distress. If the patient is obstructed? Is it the lung or the heart, etc. Next page we have cardiology. Observation means includes what you want to watch for in a cardio patient. And here I have a diagram for where to listen for the different heart valves. You can see that the relevant ribs are numbered 3, 4, 5. And this is to remind you what each sound represents when you're listening to the heart. Keep going, we have the grade of heart murmur and some quick differentials for different heart murmurs. Flip to the back, we have an ECG section. This is the 6-number rule for getting a heart rate when you're reading ECG at the standard paper speed. Below we have what P wave is, what QRS is, and the very important questions that we want to ask ourselves when reading an ECG. Table at the bottom shows the common arrhythmias and their characteristics. That's our cardio section. And next we have an orange page for diagnostic imaging. Normal reference for cardiac silhouette on the lateral view or VD or DV view. And then VHS, if you remember what that is, that's the vertebral heart size. It means on lateral view, you measure the width and the height of the heart and take the line to compare it to the length of your vertebra, starting from T4, and then you add the width and the height up to get a VHS. In this table, it just shows you the normal reference for VHS. And then you have the pulmonary patterns and what they look like. At the bottom is the normally visualized abdominal structures on a radiograph. This table is pretty self-explanatory except probably for the large intestine part. Max diameter of colon to L5 length, that's your ratio. If the ratio is greater than 1.48, that's a good indicator of a megacolon. And I also want to make a note that under prostate, the ST means soft tissue opacity. Flip to the back, you have a table on how to describe the bone lesions. Honestly, it's probably not going to be very useful in clinic, but you can look at it if you're interested. I may change this section to something else. Below this, you have some tips for ultrasound. I put the bright and dark colors because I can never remember which one's which. And in case you didn't notice, the hypoechoic is actually misspelled. I will fix this for the next version. And at the bottom, you have the common artifacts on ultrasound, and you may want to read over it before doing an ultrasound. Okay, next up is the neurology section for a total of 3 pages. The first 2 pages are checklists for the neuro exam. It's fairly straightforward because it's strictly from our neuro course. The second page is on the front is a list of cranial nerves and how you may test cranial nerve deficits. At the back, you have some tips for neurolocalization. Nothing new from other sources. And then the last page, there's a coma scale if you are presented with a case that is suspected head trauma. You may want to use the scale to assess the patient. And then flip to the back is a page of probably everything you want to know with seizures and epilepsy for a quick review. It includes the differentials, neurolocalizations, diagnostic workup, and some treatment options. Next, we have light green for ophthalmology, just 1 page. At the front is a thorough eye exam protocol, and flip to the back are the ocular tests that we learned in class and the references and differentials. Move on to the dark green page. That's for preventative medicine. On the top are 2 tables for vaccination schedules. The green ones are the core vaccines and the gray ones are your optional vaccines. I do want to mention that for the feline core combination vaccine schedule, you have the option to do the 4-dose or 3-dose protocol. The 4-dose is the lighter green, so you can see they are in slightly different colors to help you tell them apart. And at the bottom we have a chart that shows you the commonly used antiparasitics. I would just be careful with the product name because for example, Interceptor and Interceptor Plus have different spectrum, and Bravecto Plus and Bravecto Chew are different products. Products may have similar names and they may be confusing. Okay, flip the page. You have 2 tables for endocrine disorders. This is by far my favorite page because I always come back to this. The first table for clinical science is adapted from Dr. Peter Foley's PowerPoint. I love it. I have one printed and stick to my wall. The second table is for diagnostic workup. If the disorder has 2 rows to the right of the disorder's name, the first row, the top row, is what you may see from minimum database, and the second row is the diagnostic tests to work up a suspicious case. I found it really helpful, especially for internal medicine. And then we have blue for fluid therapy. First table is the blood volume and maintenance fluid rate for some common species. Second table has the different types of fluid and what each type of fluid is indicated for. At the back, it shows you how to calculate fluid deficits. Just be careful with the units. The volume in the formula is in liter, and I've made the mistake before where I calculated the volume like this doesn't look right, and then I ended up realizing that I used the wrong unit. So fluid deficits, ongoing fluid loss, shock dose, just be careful with the unit and the time frame for which you want to administer your fluid for, and I think you would be good. Next, let's move on to the dark blue pages. There are 3 pages for clinical pathology. First page is the differentials for anemia and erythrocytosis. It also has the degree of regeneration in this table here, and I would highly recommend highlighting these numbers if you're like someone like me that always need to come back to them. Highlighting them would be a good idea. Flip the page, you have the section for white blood cells. If you take a look at the diagram, I would like you to make a note that this diagram applies to all white blood cells and red blood cells. So if you have a low hematocrit or neutrophils, you apply the same rule for determining mild, moderate, marked anemia. And below the diagram is a table for the 30 leucograms. Pretty straightforward, but I want to point out a mistake that I made in here. So under inflammation, there's left shift, neutropenia and neutrophilia, and there's like a little smiling and sad faces there. And the smiling face is supposed to indicate a better prognosis, and the sad face for poor or worse prognosis, and I actually have them in the opposite order. Neutropenia should carry a poor prognosis with the sad face, and neutrophilia should carry a better prognosis with a smiling face, because with neutrophilia the body is still able to generate neutrophils, and that's a better prognosis than neutropenia. And below that you have the degree of left shift, some information about toxic changes, and leukemia. On to the next page, we have a similar diagram for platelets. And I would like to point out that the lower side of the diagram is exactly the same as the other diagram on the last page. But the higher end, if you take a look at the numbers at the top, is different from the last one. For blood cells, a moderate increase is a higher than 2-fold the upper reference, and for marked is higher than threefold. But for platelets, it's actually a moderate increase is actually higher than 1 1/3 fold of the upper reference. So that's just like a little different from the rule that we usually apply to red blood cells and white blood cells. And in the middle section is for coagulation tests, how to interpret the results, which pathway is abnormal based on which test is prolonged. And at the bottom, the table helps to interpret the PCV and total solid abnormalities in a quick assessment. Flip to the back, we have a page for blood gas. Although these numbers are taken directly from Dr. Clancy's PowerPoints, I did find that these references are slightly different from what I saw in the hospital. So I guess different clinicians have different comfort zones. And if you can find out yours as you work through the cases, you can write it on the notes. I think that's it for the blood gas. On the next page, we have a table for azotemia, a table for proteinuria, for the pre-renal, renal, post-renal causes. And at the bottom is a table for urinalysis and what you may find normal in a urine sample. I think this is pretty self-explanatory, but I do want to make a note here that the amorphous urates can be normal in urine, but ammonium urates are always abnormal. These are two different types of uric crystals, and I sometimes got them confused. Okay, at the back, this is our last page for ClinPath. Is Dr. Clancy's biochemistry buddies to interpret together. I did add a little something next to the bilirubin. Is something that I always come back to check is which of the liver enzymes are hepatocellular and which ones are cholestatic. So I just put it under the bilirubin section and highlighted it so I can put it somewhere. Okay, we're almost to the end. So, purple for anesthesiology. The first table includes information that you need to set up for anesthesia machine. The second table is to help you monitor patients' depth during anesthesia. And the bottom table is to help you troubleshoot some common problems that you may encounter during anesthetic monitoring. And then you get a big table for the pre-meds and payments. I find it pretty clear just by looking at the table. It has a generic drug name, time to onset, duration of action, drug effects and side effects, and the dosages in mg per kg. If the drug has a reversal agent, it's also listed under the drug's name. Okay. And after that, you have the 2 pain scale for cats and dogs that we use in ABC. And lastly, there are some common abbreviations that you may find helpful. And the last page is just my references, acknowledgements, and contact info. You can totally take that out, or I use it as a bookmark in my notebook. Alright, I hope you find the video helpful. If you have any questions or suggestions, you can always direct message me, email, or comment on the video. I will work on my second edition in the next year, and it will likely be ready for public sales in 2023. Thank you.